We're Nick Lombardino and Zach Blumenfeld, co-founders of CultureCon. Welcome to a special series on the CultureCon podcast, WorkPossible.
This series is brought to you in partnership with our friends at Fauna, a global employee experience agency who design great workdays for happier people, stronger teams, and better businesses. Just like us, Fauna believes in human experience design and big business impact.
In each episode, Fauna will host conversations that push us to reimagine and redefine what it means to experience work, with people who are pushing what's possible in employee experience, from first hellos to fond farewells.
The WorkPossible series starts now.
Welcome, everyone. It's another fantastic, we hope, episode of WorkPossible, and we have a really special episode today. Hattie and I have had the pleasure of working very closely with our guest today, and so we speak from firsthand experience when we say you're in for a treat, and this is an individual that has so much rich experience and is a real passion for what's possible in the workplace. So I'm really delighted to introduce you all to Sven Gierlinger. He's the Chief Patient Experience Officer for Northwell Health, which is one of the largest health systems in the United States. It is, I speak from experience when I say it's one of the most progressive and customer-centric health systems in the country. I worked there myself for many years, so I speak from experience. And while Sven's official remit is patient experience, I know it to be true that he is also an incredible advocate, a powerful advocate for something that many experienced leaders, well, they talk about it, but they don't truly act on it. And I know that is not the case when it comes to Sven. He absolutely believes, as do Hattie and I, that exceptional patient or customer experience is impossible without exceptional employee experience. And so in healthcare, Sven will talk about, I know, that connection isn't abstract and it can be truly life or death. So, when you think about it, a nurse who feels supported and valued just shows up differently at the bedside, which is vital, or a front desk member who's listened to and seen is a lot likely to listen and see how to care for an anxious patient. And so Sven has seen all of that firsthand, that you can't design your way around a broken employee experience. You can't train your way past burnout, and you can't script empathy into existence when your people are running on empty.
And I think what makes us so excited about this conversation and so valuable, Sven, for everybody to hear your perspective is, you're coming from this patient and customer experience. You're a leader who has transformed a customer experience in partnership with employee experience in the reality. So I know, Sven, when we get into your journey, that's going to sort of reveal the reality that great CX leaders that they inevitably become champions for their employees, and not because that's in yours or their KPIs, but because it's really the only way that the work actually works. So this is about the messy, honest truth of what it takes to transform experience in an industry like many others that's under extraordinary pressure. So Sven, thank you. Welcome. We couldn't be more delighted to be having this conversation. We obviously have all worked together before quite some years ago now, terrifyingly, maybe even nearly 10 years ago. But way before that, Sven, tell us your story. Tell us why you're in customer and patient experience. Give us a little insight into your world.
Well, first of all, it's such a pleasure to be with you. It's such an honor and privilege. I was looking forward to this all day. So so much respect for both of you, and individually and together as a team, and for you to do this podcast, it's just really incredible. So, and thank you for the very generous introduction. And right off the bat, I think you said transformed the experience. I want to turn it into an active verb. It's transforming because it's never done work. It's a journey, and we're just at some point in the journey, and we're moving in a towards a destination, and you never really get there. And that's the beauty about it. And that's what energizes me. So about my background, healthcare is actually my third industry that I have the privilege to work in. And truly, this is the ultimate privilege to work in healthcare. I started out in the hospitality industry very young, at 10 years old. My parents owned a restaurant where I was drawn to from a very early age. I just love people. I love serving people. And that's what I discovered there. And eventually worked my way up in the hospitality industry through many different frontline positions, which I draw from a lot, especially when we talk about employee experience, because I have been there, and especially in the hospitality industry. And then I went into hotel management, and I was very lucky to had the opportunity to work for the Ritz-Carlton hotel company, company that is hyper-focused on employee engagement, employee experience. That translates then to the legendary brand, the luxury brand of Ritz-Carlton. And I worked there almost for a decade, and that's also what brought me to the U.S., originally from Germany. And I found my way into healthcare. Now I've been 17 years in healthcare. There will be the point will come soon where I actually have worked longer in healthcare, very soon, in my prior life. But I remind myself every day that I want to be the outsider. I want to continue to remain in the hospitality industry because that's the value I bring into healthcare, and that sometimes gets a little hard, but that's critically important. But one important aspect of experience that is not on my resume, it's on my LinkedIn profile though, and that's really the reason and the why I am in healthcare today, is my personal health experience I had while I actually worked at Ritz-Carlton. To make a very long story short, I was paralyzed with a disease called Guillain-Barré Syndrome, which is a neurological disorder that paralyzed me from head to toe. Luckily, it is not a chronic disease. It is acute, but it was very difficult to get through this. I was hospitalized for 3 months, including on an ICU on a ventilator with a feeding tube up my nose, couldn't move any limbs and any part of my body for that matter. And then still came out in a wheelchair and was in home care, acute, and then post-acute care and rehab in an ambulatory facility. And the whole experience was about a year until I was fully recovered. And I learned a lot about healthcare, my personal journey. And I always joke that's my medical training. I didn't go to medical school, but that was grueling and hard and rewarding at the same time. Most importantly, I realized through that experience what healthcare is all about and what the essence of healthcare is, and that healthcare, like many other industries, but more so in healthcare than any other, is people taking care of people. It's ultimately the human experience that matters, and that how I felt as a patient was always dependent on the next person that walked in the door and that took care of me, and how I felt about that experience, and whether they made a connection with me, whether they built a relationship with me in that moment. And that ultimately made me feel cared for, that made me feel safe, that determined also, I believe, the outcome in terms of whether I was healing faster or not. So now I'm on the other side. I feel myself very lucky to be on the other side. And I draw from that every single day, actually. And I have a picture of me in a wheelchair right here, right next to me on purpose, because that's, I put myself into that wheelchair because that's the perspective that we need as healthcare leaders to make the right decisions about patient care, about the patient's experience, et cetera. So that's a little bit about me in a nutshell.
Yeah. Now, listen, I actually want to just ask you a quick question. Just indulge me, because I know I've not asked you this before, but When you were going through that experience, did you know it would come to an end, or you had no idea because it was an acute illness?
Yeah, that's a great question. It was scary because I didn't know what it was and I never heard of it before. And the doctor did a great job explaining everything, but still I was scared. I am an optimist at heart. If there's a 1% chance of survival, I focus on that 1% chance and I don't see the 99%. And I think that helped me a lot. Although there's a much higher chance of survival for this, and although some people have unfortunately died from it because it affects your lungs, you can suffocate from it. While I was still able to function a little bit and was already in the hospital, I was lucky that there was a little research center on that floor, like a little library with a computer and an internet connection. And I went online, and that's 25 years ago, so that was like the early days of the internet, and I found stories of patients that had Guillain-Barré Syndrome, and I was reading every single story, and I found common themes in that it was unexpected, scary, hard to go through, but in the end, most people recovered 100%, and that gave me hope, and that hope is so critical in healthcare, and that we need to be hope agents for people. And I was able to do this myself, but then also the staff members, the nurses, the physical therapists. So one of the physical therapists always said to me, "I love Guillain-Barré patients. They always get better." Versus sometimes, stroke patients or others that have permanent disabilities as a result of that. So having clung on to that, helped me get through it, and I'm lucky that it gave the fruition.
I remember the very first time that I heard you tell your story, and it was in Beginnings, which is, for anyone who doesn't know, Northwell's still weekly?
Twice a week now.
Twice?
Monday and every other, mostly twice a week, yeah.
Okay, so the onboarding event, essentially, where Northwell bring together new team members and immerse them, not in the operational reality of what the role is going to be, but in the cultural reality and in the culture of care that you so well defined. And I remember I attended it and I was new to Northwell and I heard you tell that story. And I remember you said, a patient experience should be treated like a hospitality experience. That we should know that there is nothing stopping us creating luxury for these people. It's just that luxury means something different when you're a patient. How long was it in between your health experience and then leaving Ritz-Carlton and deciding that actually perhaps you want to use this knowledge to build luxury elsewhere?
Yeah, that's a great question. It was about, I think it was 7 years later from having had that experience. So I didn't walk out of the hospital saying, "Oh my gosh, I want to work in healthcare."
You probably thought, I need to get away from healthcare.
I had some, PTSD to work through first, but it was an opportunity that presented itself to me. And I was actually asked by a health system whether I knew somebody like me that would want to join a new hospital that they were opening. It was Henry Ford Health System in Detroit. And at first it didn't click with me. And I was said, yeah, let me think about it. If I'll go through my Rolodex, through my LinkedIn and see if somebody comes to mind. Because I was very happy in my job. And then all of a sudden it clicked and said, oh my gosh, I have this experience as a patient where I almost died and was paralyzed that I can now marry with my professional experience as a hospitality executive. And I think it's a combination that will be very fruitful. And I'm glad I thought of that, and that I made the decision to do that. And you talked about that luxury is something different in healthcare, and what comes to mind there is that even at Ritz-Carlton, when I worked there, our CEO, the legendary hotelier Horst Schulze, who really founded Ritz-Carlton and built the brand, the modern Ritz-Carlton brand. Very visionary leader, very just incredible guy. And he used to drill into us that and his words were like, "You think you are in the hotel business. Let me tell you something. You're not in the hotel business. You're in the relationship business. Our purpose is to build relationships with the people that we're serving. And that's the luxury. It's not the crystal chandeliers and the marble floor and the ocean views and all the things that come with the Ritz-Carlton. It is the purpose. It is the relationship, that making the person that we're serving feel known, feel cared for, feel like they're at home. And that directly translates into healthcare, word for word. And I've actually once taken the credo of Ritz-Carlton, which is the experience statement, basically, of what a Ritz-Carlton is like. And I just switched out every word that mentioned hotel or Ritz-Carlton to healthcare. And it works because Ritz-Carlton talked about a place that enlivens the senses and instills well-being. It's a healthcare. That's what healthcare does.
So obviously what we want to talk about is your view, your completely unique perspective of if we want our employees, our team members to give this amazing experience, to have the headspace, to have the level of self-well-being that they can connect with people. Let's get to that. But first, give people a few tangible examples of some of the things that you've done that you've loved. Because, Elaine and I will often talk about this. Some of the pieces that you put in a decade ago into Northwell are super innovative now in other industries. It is still people are not doing that. And I think one of the things that's always been amazing about your work is you've sort of ripped up the rule book. The thing that comes to mind is why can't patients eat Michelin-star food? Why does hospital food have to be absolutely dreadful and make us feel much worse while we're there? Why can't we make it the easiest possible experience for these people going through some of the hardest times of their life? So share some of your highlights over the last few years, the things that you've put into place.
So, well, first of all, as I said, it's a journey, an iterative process. And where we started, and Elaine knows that very well because we worked together on this, is with culture. That's the first thing I did, and I was so lucky to find a partner like Elaine in that work, to build a foundation with people that have the purpose that I was talking about earlier, and have the sort of the natural abilities to care for others, because that's something that you find it in many industries, that you come across people, and in healthcare, it's horrible when that happens. That's why is this person in a position where they're dealing with other people? They should be behind the scenes. They shouldn't talk to somebody because they don't know how to talk to somebody. So there's some basic foundational elements in team members that you need to look for when you want to create a great customer experience. At Ritz-Carlton, and that was actually one of the interview questions in the structured interviews, where we asked them, "Are you a natural smiler? And why do you smile?" And obviously those are phone interviews first, and then when we got to meet them in person, then you get a sense, you get a feeling whether you want to be interacting with that person, whether you want to be taken care of by that individual. And I always say, if somebody doesn't impress you in the first 2 minutes, then don't put them in a customer-facing role, because that's how long a customer has when they're registering for an appointment, or even being on the phone, and whether somebody's kind and nice on the phone. So that's the foundation, the entry level, and then you build on top of that. Then you mentioned onboarding, right? So it was important that, in addition to which, we're very lucky that our CEO takes the time to meet every new employee, and it's in person.
I want to underscore that, everyone. Like, the CEO does it in person. It matters that much to him. He works his schedule around it. Like, that is still unheard of, as much as it shouldn't be in today's world.
Literally unheard of. In the tens and tens of organizations I've been in since Northwell, it is still the only one. And I tell people that story and they can't believe it. They cannot believe it. Every week? In person every week? What, no, you have to go there? Yes. And people want to go there, the immersive part of it. And culture of care, Sven, that was, I guess, the way you articulate it, the cultural expectation.
That's what we introduce on the first day then after the CEO, where I go on stage and also, if the boss does it, I have to do it, but I want to do it, obviously. I asked him if we can also set the expectations on day one that patient experience is important to us and setting expectations for our employees. And the culture of care defines that. And it's each letter stands for some things. It's an acronym. The C stands for connectedness. It's the connections we make with, as I described earlier, with our patients, our customers. The A stands for the awareness, constant awareness of the needs of the individual that we're dealing with, and that's the expected needs and the unexpected needs. The R stands for respect, so to treat all individuals with respect and dignity, and that also translates to team members, as that creates a team environment that patients are privy to and they see, and that they're within also. And then the E stands for empathy, that we lead with empathy, that empathy is not just a word or something we say we do, but that leaders really model that behavior to employees, because mostly, not just mostly, I think every person that walks into our doors probably has a worse day than we do, because they come there for something that they're dealing with. And obviously very much so the case in the acute care environment in hospitals and ICUs, et cetera. And that's something that is key at all levels of the organization.
And I think this is where the partnership comes in, isn't it? And I obviously had a very small part in the work that you both did for many, many years. And the thing that I remember so clearly is going around the hospitals and speaking to thousands of team members who said, I need to be able to have the energy to give that. I need to be able to have the headspace. I need to be able to have the experience that I deserve at work in order to be able to make that happen. Do you have any stories that spring to mind where you think that's either worked really well or it has?
The biggest story that immediately comes to mind is how we dealt with the crisis of COVID, and how our work on culture really paid off during that time. I mean, all of healthcare was obviously under siege, but we were particularly under siege in New York. In some of our hospitals were at the epicenter of COVID. New York was in general, and we had no answers at that moment. People were flooding our ERs, and people were dying left and right. And it was to watch our workforce, our employees work through that. When I get asked often in preparation for speeches, like, who inspires you? It's our frontline people that inspire me. And to have been witness to that and being part of that was just absolutely incredible. And that our tagline for this is you're made for this, and you helped us create that. And it was like a foreshadow of what was about to happen. And that's what everybody clung to. And that's where we pivoted to, we have to take care of our employees, and they will take care of the patients, really. And all the patient experience work that we've done pivoted to just supporting our staff. And that, that's obviously the most dramatic example, but it is
dramatic, but real.
Yes, absolutely.
Yes, incredible. And I remember that time. And I remember getting the call from the employee experience team, and the first thing that they had jumped to was a support plan that then phased into a recovery plan. And that was an all hands on deck. I mean, everybody from your department, from the people team, from everybody just sort of threw themselves at how do we care for these people who are in the most life-changing situation that you could possibly imagine in workplace.
And the ideas that sprung up there were just tremendous. Turning our cafeterias into grocery stores, that they don't have to stop on a grocery store and they can take the essentials home from, eggs and lettuce and milk and all the that they need. And it's just one small examples, but there were many of them. We created wellness kits that my team did. There were lavender kits with all kinds of things to help them, and for patients also, that came to our ERs so they can manage themselves at home. And everything went away. All red tape was gone during that time. People put away their titles and their role, their functional roles, and everybody was just singular focus and taking care of our people and that take care of the of our customers, our patients, the communities.
And I remember the support that you pulled together for the mental health of the people at work. And I remember having conversations with the employee experience team, the team member experience team, that said, how are we going to equip these people to talk about someone who's potentially feeling suicidal? How are we going to equip these people to deal with a total reality shift in their workplace?
And that's still ongoing. All those resources that we put in place are still ongoing because COVID was very intense, but in general, healthcare has gotten harder and people have become more difficult, and it's a more hostile environment for our people to provide care in, and all these resources are still active and going to support them. And we're helping people identify stress, for example. There's a program called Stress First Aid, where you verbalize how stressed you are on a color scale, actually. And when you're orange, then you should be, we need to support them. When you're red, then it's very serious. And we're green, and everything is good. And that's especially for providers, especially for frontline employees. We've rolled that out across the entire organization. Team Lavender, actually our patient experience team leads that. And that is a multidisciplinary team that comes together when something bad happens in a hospital. A pediatric death in an emergency room, for example, and and the employees are grieving as much as the family is, and they need help, or something happens to an employee in the hospital, and they come together and all the time out and bring all the resources to support that team that goes on every day, dozens of times across our organization, and that's unique, and that's very special, and that's something that also we started pre-COVID, and then it sort of exploded during COVID, and it's alive and well in our organization, and we're very proud of that those are some of the resources that we provide.
And they're not resources that live online. They're resources that are human to human in a way that I don't see still now in other organizations. I think lots of organizations signpost that there are EAP programs, and that it's there, but is it there that we drop everything and somebody goes into that red or orange zone and we know that we're going to get there because we know that these people can in no way be expected to care for a patient when they need support themselves?
I would just say, I now look back and realize the value of the lightning in a bottle that we did have. And though maybe that doesn't get repeated again, I think the eternal quest for it is sort of part of our shared purpose. I think that's why the three of us still do what we do, is that we saw firsthand how the right juxtaposition of these two worlds of the customer patient experience and employee experience, when they're harnessed together and they work symbiotically, like it's an accelerant inside of a company like you can't even imagine.
Agreed. I wonder, Sven, thinking about your world, whether you're sticking closer to patient and customer experience or employee and team member experience, or it's an amalgamation of everything, which is really the reality. If you could just change one thing in the playbook forget the rules on one thing, what do you think you'd want to do?
Something I think a lot about is how we deal with failure, right? A lot of companies talk about that you have to give room for failure, and that's how we learn and that's how we grow. And I totally believe that. I think we're a product of our failures, right? Because we learn and grow from it. But we don't celebrate it. I don't know if you know the quote from, I'm sure you know, from Thomas Edison when he was developing the light bulb, and reportedly 10,000 times he failed. And he was asked about that. And he said, I didn't fail. I just found 10,000 ways that didn't work until it actually worked. And that's something that, what if there would be that, a celebration around that, because it means that we at least tried, that we tried to do something. People are afraid to lead or to make progress because they're afraid of failure. And if you give voice to that, and especially on a leadership level, on a frontline level, that it's still taboo. It's still like I have to lead with my strengths and mask everything else. And I think we're taking away some of the authenticity. And if I could change anything, that probably what this leads to is to let people be their authentic self, because that's what then translates also into a customer experience, that they're looking for authenticity in the individual and authenticity in the brand. They're looking at purpose, etc. And that's something that is, also something that we learned at Ritz-Carlton, where Ritz-Carlton was famous for, after every interaction, saying, "That's my pleasure." Certainly. And guests eventually told us, like, you're my pleasuring me to death. It has become robotic and monotone, and we had to pivot and let people be who they are and not be too scripted. And that eventually was a better service experience than when it was scripted, because somebody just said, my pleasure. And and that's what I mean.
It also strikes me that's a psychologically safe work environment, right? When you can be yourself and you don't feel like you have to be in a certain box or a certain way, and you can sort of step out of the norm. I think it's such a relevant example in today's workplaces. I mean, whatever buzzword du jour you want to use, the premise simply is this: when people feel safe, when they feel empowered, when they feel like they can bring their whole self to work and not be sort of tied down with being a certain way, that's that spark between two humans, or that's that spark of an idea, right? That gets to live and breathe and be full, versus you keeping everybody smaller or in a rigid place. I'm really passionate about that being such an important part of work day to day. So I love that example. And the other one I thought of when you were talking was, when it might be the Ritz-Carlton, but one of the companies they have $1,000 or something to fix it. Like, you don't have to ask for permission. You don't have to go and get layers of documents written down. You don't need a form. But if you can solve a customer's problem up to $1,000, just spend it and do it. It might have been Nordstrom. I can't remember now.
Ritz-Carlton, and it was $2,000.
Was it 2,000? Okay.
Yes.
Great. Yeah.
And it always freaked the finance people out but the reality was that it was an empowerment. It was exactly that. It was believing in the employee that they make the right decision, that they're not going to waste that they're a business owner, and that's what happened. There were certain areas in the hotel that had to use it more often, like front desk employees, because most of the complaints are done at the front desk, but it was for everybody. It was for housekeeper on the floor. Imagine how empowering that is, that we, the company, give them $2,000 to solve a customer problem. That means that they could comp somebody's 4-night stay and say, that's on me. you had a bad experience. My judgment is, and in all the years I was there, I can probably count 2 times where that happened for like somebody like a housekeeping employees. But the message that it sent was much greater than the dollar value that was put on that. Hugely important, and it got everybody to focus on that. The tagline was "Move heaven and earth" to make sure that we never lose a guest. That's another mentality that's not inherent in healthcare, where often the attitude historically has been, especially for high quality healthcare organizations or physicians, etc. It's like, you're lucky that you get to see me. You're lucky that you get to see us, because there's people that are waiting for 3 months to get in here. And if you're unhappy, there's somebody else right behind you. And to really think of the patient as a customer, and that thinking of that has needs, same for the employee. They're in the center of everything we do. And it's that relationship again that is magic when that happens.
The examples you just given are going to be inspiring for a lot of people, especially when you think about the partnership of it. So I think if you say to some organizations, all of your people could have $2,000 to fix a customer problem, I think people will think it's extreme, but the reality is it isn't extreme. It's just only possible when the right people and teams come together to make that possible. It makes me think of, do you remember Buddy's curtain?
Yes, of course.
This is what that makes me think of.
I tell that story all the time. I use it in any industry all the time.
That is an amazing story. It's an amazing story because it brings together lessons, I think, from so many disciplines. You created an environment at Northwell, an infrastructure at Northwell that allowed anybody to have an idea that would improve the organization, the health system, the patient experience. And then if that idea was good, we would run with it. And so, you think about what that provides. That's innovation, it's empowerment, it's psych safety, there's benefits to the customer experience. It's just, I would love to see organizations bring these teams together more actively and just do one big initiative like that. Once a year, one big initiative, and just build up the layers, because I think that's what you've done so well over the years is layer by layer by layer by layer, more and more availability and connection between we're going to look after you so that you can look after them.
Let's explain real quick what Buddy's curtain is, maybe for the audience. I can't take credit for that, but it is something that is very, actually an organizational value to us as innovation. And this is one example of where one of our housekeepers basically got tired of every time a patient was discharged to change out the entire curtain. And there was a lot of labor involved, and figured out, backed by testing and by research, then when they did microbial counts on the actual curtain, that all of the germs were actually just where whoever touched the curtain pulled the curtain close. And so he came up with the idea is, if we just take away that section, these 2 feet, and make that with Velcro, I don't have to change the entire curtain. And it was a brilliant idea. It was backed by science, and it turned into a business, actually. And it's saved millions of dollars, and it's and turned into a business where he's actually a business owner now. He has a stake in that company, and now this has evolved, and we have a Shark Tank competition in our organization where there's a formal process where employees just put forward good ideas, and then we help them, we coach them to get their pitch ready and develop the idea further. And then they sit in front of sharks, like in the TV show. And those are outside panel, basically, from very high caliber individuals. And then we pick 2 winners, and each of them get awarded with $500,000 each to develop the idea and then eventually to turn it into a company, which is just, it generates an enormous amount of energy around idea generation.
Just think of even the ripple effects of that. One of those ideas signaling that this organization is a place to act and have ideas. If I think the patient can be looked after better or in a different way, I can say it.
I love the connection to sometimes in companies, all industries, it's like only the executive layer has the ideas or sets something up. And I think it just sends that message that the people have the answers, right? And I don't know how many times I've been coaching people to say, why are you sitting here struggling to figure this out? Go talk to the people that are on that front line dealing with that thing. I bet you they can tell you what to do about this. And it's just so funny that we miss that in the midst of it all with the teams that are literally running the show and dealing with the stuff and interfacing with the customers and dealing with the machine that doesn't work right or the process that's broken. Yet the execs sit in a room grumbling about it and trying to figure it out. Like, just go talk to the people.
Well, I know we're sort of coming to time, Sven, but firstly, thank you. I'm sure that you have given some unbelievable inspiration to people with some really tangible examples. So thank you for that. If you were going to leave people who perhaps didn't know where to get started, they can see the value, they know theoretically that the better employee experience we create, the better their customer experience will be. What piece of advice would you give them? Or where should people start?
There's two things I believe you need to do. And one is to put yourself in the shoes of the customer and to look at the experience through their lens. And that means physically walking through there. And that's how I start every job is to, when I started here at Northwell, I was Elaine knows that, I put on jeans and polo shirt and baseball cap and I sat in our waiting rooms and I watched and observed and I went through from the parking lot to the physician practice to any place that I could get to and observed. And I call them seeing routes. Where you take the time to see what the environment is like, how the people are interacting with each other, staff members with each other, how we're speaking to the patient, listening to patients and customers and see what they're talking about. You learn so much from that. The more you do that, the better off you are. And the same thing, spend time at the front lines. Get behind that registration desk and sit with people. I've gone to our contact center and sat next to a contact center agent and listened for hours to phone conversations and asked questions. And that is, to me, the most important thing we can do as executives because it really gives you a different perspective. It opens your eyes to some of the problems and you can relate better to the challenges that we're faced with. And that's at the intersection of employee experience and customer experience. And there's no better way than going to the front lines.
Truly fantastic advice. And you're right. It doesn't sound difficult, does it? We just need to start.
And listen to the voice of the customer that is employees and to external customers.
Look, Sven, thank you again. It has been an absolute joy. It's wonderful to see you again. It's amazing to hear about the work that has been done, that has continued and just always continues to grow. It's never short of something new and inspiring. So thank you.
Thank you. It's been a pleasure. I thought we were just getting started.
I know, right? We could keep going for a long time. It's true. But I would just offer to the listeners as well, if you haven't checked out Sven and some of the great work that he and Northwell do, definitely connect with them on LinkedIn. I think you'll just be inspired by the stories. There's actually some Netflix documentaries about Northwell Health as well that you should definitely check out. And again, whether or not you're in healthcare, I think the lessons that we've talked about today and just those examples, if you really look at them, they have great applicability to pretty much any industry and any business that you find yourself in. So just great words of wisdom to look by. And as you can tell, big fan. This is someone that both Hattie and I, lifelong friends, lifelong partners in crime, and just really appreciate you so much. Thanks a lot.
Same here. Thank you.
From first hellos to fond farewells, Fauna designs employee experiences for happier people, stronger teams, and better businesses. No frameworks, no playbooks, just real transformation. Are you ready to experience possible? Visit thefauna.co.uk. You've been listening to Work Possible, a special series of the CultureCon podcast. We hope today's conversation has sparked some possibilities for you. Subscribe for fresh perspectives, ideas bold enough to change things, and a whole host of opportunities to bin the playbook.
That's a wrap on this episode of the official CultureCon podcast.
If you got something out of it, share it with a friend, a teammate, or a fellow culture geek.
And don't forget to hit subscribe so you never miss an episode.
And if you want more ways to stay connected and inspired, check out our upcoming events page for a full listing of webinars, workshops, and conferences.
You'll find the link in the show notes, and we'd love to welcome you to a CultureCon event soon.
Until next time,